Okay, thanks all for you guys being here and your patience with getting things set up. It's been a while since our last provider meeting, and we just wanted to give a high level overview, kind of where we're at with training, scheduling, and some other highlights, and just really give you guys the opportunity to ask the questions I know you have. I'm getting a lot of questions, but I don't know that we'll be able to get them all answered here today, but what we can do is we can take the list and definitely make sure we get the answers for you guys. So I'll let Tim go and start just kind of with where we're at with the timeline and letting people know where we are with things. If he's on. So. Tim, you're on mute. Perfect.
Yes, sorry, it's a little bit clunky over here still. So we've got the agenda here, just a quick update on timeline and a project update, and then a little bit about training. So without, geez. Okay, so our timeline, we've all seen this slide before. Here we are, kind of heading towards the middle of August, and you'll see the middle bars there at the end of phase 2. So with us being at the end of phase 2, we are kind of getting through all of our testing and our readiness phases. And at the start of September, we start in earnest our training phase. So on September 6th, we'll begin end user training. More about that in some training slides later. But yeah, we are here about, what, 80 days before go live. From a project update perspective, just a few details on what phase 2 included. So again, I mentioned testing earlier. That was largely done with the Sanford and Epic teams, you know, with them being the application analysts and the experts of the actual Epic system itself. They did a deep dive into the application testing and integrated testing. They are working with us on a handful of different testing activities with respect to charging. Wade and team are doing a ton around technical dress rehearsal. The technical dress rehearsal incorporates us going out and testing all of the pieces of hardware that users will access with Epic, and that's not only the computers themselves, and the keyboards and the mouse that's attached to those computers, but it's also peripheral devices like scanners, e-signature pads, printers, label printers, etc. So all of that is getting tested. That's a huge initiative, and that will just make sure that come day 1 of go live, we see a heck of a lot less of our end user device issues. So that testing is going well. We've got change management happening at the operational level. I know on the clinical side, we've identified 60 potential risks of varying severity and likelihood of happening, but we rank all of those and say, okay, you know, let's put mitigation plans in place. Most of them are low likelihood with either low or medium impact. So those we prioritize down, but we still have mitigation strategies and owners for all of these different potential risks that could pop up for our implementation come November 1. And we are planning for those accordingly. The workflow walkthrough, that was held July 26th and 27th. And if you remember back to January, we had a kickoff. That kickoff showed us Epic workflows that were in Sanford's system. So we were looking at Sanford's build in their Sanford emergency department or the Sanford radiology department or imaging or pharmacy, etc. The workflow walkthrough that we saw in July, at the end of July there, that was actually our system. It's what we will be going live on in production. So we got to see our build and our workflows and all of the work that took place from January to May of designing that system and making sure that it was set up for us. We got to see the reality of that system. So it was really neat. It generated a lot of excitement. I heard a lot of really positive feedback on that session. So that was really nice to see our actual system and the workflows that we'll be going live on. A couple other things for testing phase here is we've got the Go Live Readiness Assessment, or acronym GLRA. We've done 2 of 4 of those already. We had the 120-day and the 90-day there, you can see. Both were rated as a watch, which in my 19 years of implementing Epic is the norm. From the 120-day GLRA to the 90-day GLRA, we did see a handful of areas improve, and we really dive into all clinical areas. and then all business areas, all ancillary areas, and then integrated areas, etc. So it's a pretty all-encompassing look into the project, into each of the specific areas of build and setup. And we have seen some improvements from the 120 to 90 day, and we'll continue to see those improvements as we go from 60 to 30. So the overall message there is that we are on track. We're feeling confident about our November 1st go live. And while there are certainly things that are a watch status, and we have to make sure that we're paying attention to those as a operational team or technical team or leadership team, depending on the issue, they all have plans that we're confident in for resolution and making sure that we wrap everything up by that go live time and that we can be successful. So we've got owners and plans and due dates, and we're tracking to those. Nothing at this point seems like a swirling or that we don't have a plan in place to deal with the situations that we're finding ourselves in. So that's all good. And then reminder, as we go through these last few months of the project, certainly please feel empowered to ask questions. It's important that if you're smelling smoke or you're just confused or there's something out there, we don't want any questions to go unanswered. It likely is going to be an easy answer, and we can get you the information that you need or help you find whatever you're looking for. But it very well might be something that, hey, let's have a deeper conversation about that. And sure, we do a little bit of work, and we can make that even better and stronger for our go live, reducing our risk come November 1. All right, a little bit more about the testing phase is around training. So on August 1st, so last week Monday, we started our training of our super trainers. So Stanford folks came out and they actually trained our operational end users who will become super trainers, as well as our super users. So our super trainers will train all of the masses across the Lake Region health system, and then those super users will help support those super trainers, and they will participate in go live support as well come November 1st through 14th. So we'll have them on the floor to be able to ask questions to and kind of just help us make sure we're using the Epic system as efficiently as possible. There are oftentimes 5 or 6 different ways to do something in Epic, and one of those ways, if you learn it early, it might take 10 clicks, where if we optimize and do it a different way, it might take 2 clicks. So those folks will help. I highly recommend finding a super user and super trainer when you're in the early days of go live, and just say, hey, how is this all? What I'm doing making sense, and is there more efficient ways that I can use the Epic system? Because if you build good habits early and follow that, minimize your clicks, it's going to just be a lot better for you in the system. Training signups, we will have that all LRH end users will be assigned for their specific training. We've got some deep dives, a 3-hour session tomorrow to finalize that and make sure it's all buttoned up, and then we'll get that out to the end user communities so folks can get signed up for training. All right, so training is a natural flow here. We're going to just jump right into training. In this phase 3 of the project, we continue, like I said, those GLRAs, the 60-day and 30-day will continue. The end user training will take place. That starts September 6th. We are bringing in a handful of credentialed trainers from the industry that have been doing this anywhere from 10 to 20 years, just to help out with our training and make sure that we, one, have high quality, and 2, have the bandwidth to make sure we're getting everybody trained. So that's a really cool thing. And then shadow charting, only applications in scope for this is Optime Anesthesia and Stork. So we'll be doing some shadow charting with those folks, looking at our current systems and what the Epic system is. And that just helps with readiness and making sure that the system is set up for those areas that are so important to the organization. Some more things about training, the phase 3. We do customization labs. So 2 weeks before go live, that last part of October there, we'll have sessions where users can log into their production environment. So it'll be up and ready, test their login IDs and passwords, which is great to do before go live. Just gives you a peace of mind that everything is working, and you can practice certain workflows. So more information coming on that as we get closer to that end of October timeframe. We'll be doing both a technical cutover and a patient cutover. The cutover that's mentioned here is patient cutover that night before our go live. or that's one's actually talking about the technical. They'll go through a minute-by-minute plan to make sure that we are coming off of our current systems and that interfaces are appropriately pointed to the new Epic system and working as expected. We might have to turn on a couple of settings in Epic. There's a couple of hardware things that we have to do. So that technical cutover plan will happen. And then there's also a patient cutover. For every patient that has a seat in a bed, we need to make sure that their orders are in the new Epic system, that those orders for medications and whatnot are appearing on the electronic medical record, or the medication administration record, the MAR. Vitals are in the system. So we'll be doing both cutover activities that night before go live, and there's a lot of coordination around that. And then obviously we end that phase 3 by entering phase 4, which is go live on November 1st. So that obviously impacts the entire house. So that was a lot of content. You can certainly look back at it when this presentation hits your inboxes, but we have time for questions at the end. We can certainly jump into questions now or at the end. So if there are questions now, certainly speak up and we'll get those answered. Otherwise, we can move on to Harmony.
Tim, can I just highlight, I think, a few things about the training that'll be different for people?
Yep.
People will have to sign on to the Sanford Success Center in order to access both your online classes as well as your sign up for your actual in-person classes. So some providers have been talked to about times that they can block schedules. I'm happy to talk to more of them, but until you actually have signed yourself up in Success Center, you are not signed in and signed up for that class yet. As Tim said, we're hoping to get that rolled out. We were hoping to get it rolled out earlier this week, but we found that there were some discrepancies in the training profiles. So we want to make sure that all those are accurate before we send those out. So those hopefully will come out as soon as they can. You guys will not be allowed into the system November 1st if you have not completed your training. So it is very important that everybody completes their training, and really, like Tim said, those customization labs will be huge. We internally just don't have enough trainers. So what we have done is Tim and I have spent the last 2 weeks interviewing multiple Epic certified trainers, and we've got 4 at this point that have committed, and we've got 1 more interview this week. So those people will be new faces to us, but the good thing is a lot of these people, that's what they do. They do specifically physician and provider training. So they'll really be great resources for us, and really should be able to help customize and teach us those tips and tricks. Sorry. Any questions specifically about training? Okay. We tried to do times that wouldn't interfere completely with clinic, but there will be sometimes that's all the options there are. So if there's problems with getting yourself signed up, there'll be information in the email about who to reach out to first. You can always reach out to me too. Thanks, Tim. And I can talk about Harmony a little bit too, and Wade can maybe pop in and explain a little bit too. He doesn't know I'm going to ask him to maybe do that, but Harmony is another company that integrates into Epic, and actually is a way for us to access our legacy data. So CPSI, our Allscripts and our Paragon data. So what happened is as of the 18th of July, they pulled our data up to that point, and that is currently being converted into the system. So at go live, we will have data that is up to that point. So we will have this data gap between the middle of July to November 1. And the scope of what they were able to do for both TouchWorks and CPSI are there in detail. And what will happen is after go live, they will do another data basically pull once everything's kind of locked up and finish up with charts and all that, and charges and everything. And that'll be sometime in December, correct, Wade? And with the goal of hopefully everything from our old systems is into our new system by the beginning of April. I did have a question yesterday. Do we know how long we'll have access to our legacy systems, Wade?
As long as we want, the servers are on site for the majority of them. So CPSI is an online service, but we can maintain that one at a reduced rate for as long as we need to. But the intention is that pulling the data into Harmony will allow us to access through here once that final data pull is complete.
Okay. And this data will be on top of what is currently being abstracted by our abstractors at both our Elbow Lake and our Fergus Falls sites that really are giving a lot of those problems, allergies, things like that will already be in there too. So that will actually be in the Epic chart. And then this other is actually a link within it that we can access this. Do people have questions about Harmony? We can try to set up a little bit of a demo if people think that there'd be value to that. I just need a yes if people would like to see that at some point.
This is Laura. I think, eventually that would be a good idea, or at least some kind of training materials, because once you get into Harmony, there will be, a couple different screens you can navigate through. So we'll want to show people how to use it. I don't know what the best timing of that would be, but.
Okay, thanks for that feedback, Laura. Yeah, that's what I've got, Tim.
All right, so contact information obviously in here. Again, that'll hit your inbox. So reach out anytime for questions about the Epic project or specifically provider related. Certainly reach out to Naomi. And at this point, we have time for questions. What's out there? What's keeping people up at night? What can we help clarify? Anything is on the table. Please feel free to ask.
Tim, can you spend a minute kind of explaining where we're at with the PACS?
Sure. So from a PACS perspective, there is a project on the books for Post Live where we will continue to dive into and optimize our PACS workflows. That will happen. So Sanford has it on their optimization list. This will be part of our normal Post Live process where we meet with Sanford regularly and talk about all things. So it'll be, what issues are we seeing? What priority do we need to help resolve those issues? What other enhancements and functionality do we request out of the Epic system? How do we prioritize that? And then we get everything slated into a project plan where Sanford will say, okay, this project will happen at X time, Y time, or Z time, and then work with us to ensure that we're implementing that. There are some other things that are coming Post Live. The normal Post Live process will be things like upgrades and new functionality that Epic releases. So Sanford takes regular updates from the Epic system, or from Epic as a vendor, and they will upgrade their own systems. And as they upgrade their own systems and go live, all of their Community Connect partners, including Lake Region, will get access to that functionality at the same time. So it's a big coordinated effort. They'll have regular meetings where they'll communicate to us the functionality that is coming up in the new release, and then we can help plan for that from a provider perspective and all of the different user roles and folks that it'll impact across the house. So PACS will be one of those. Is there anything else, Naomi?
No, I think people wanted to make sure, I want to just make sure people knew that while we won't have it integrated within the system at Go Live, that is something that's still very much being looked at and explored, the options for that.
Yeah. It's a priority number one for the Post Live world. So it's definitely on the list.
Can you speak a little bit about how Imprivata works? And if it's too much to ask you to do that, you don't need to, but just how that might impact people's workflows.
Sure. Wade, you might be able to take this one, but yeah. Do you want to take that one or do you want me to?
You've seen it in the wild, so that might be the best case scenario, but the initial intentions, Epic at Sanford, they use Imprivata to help with fast user switching. So anywhere where you have multiple users that use the same computer, so maybe a clinic exam room, a hospital inpatient room, the Imprivata badge taps help log users in and out quickly and get in and out of the Epic instance quickly so that you're able to tap in and tap out and get access to the chart right away. We are looking at other potential enhancements that it could provide you, maybe in certain office settings so that you can switch back and forth quickly, get in and get out. Imprivata does not replace a username and password though. You still will have a username and password. The badge taps just allow you for a 4-hour window of time to tap in and tap out without requiring that password. So it does not eliminate passwords altogether, but does make it easier for multiple users to share workstations.
You will also be
Yeah, you
hearing
said that.
from, sorry, go ahead.
No, I was just going to say, you said that really well. The expectation is you will still have that username and password at some times, but man, Imprivata, once you do credential in and can use it, especially on those high volume workstations in an inpatient setting or in that clinic workflow where the patient gets roomed and the nurse does, the nurse pieces of that clinic flow, and then the doc comes in and is able to just tap right in. And the way that the ambulatory suite is set up, or the outpatient software, is it will take you to it'll open up the patient's chart, so you won't have to go to your schedule, find the patient, open it up, and navigate to where you need to be. It's just kind of already there. So yeah, it's a really streamlined workflow. So tapping when you get into that clinic setting is really advantageous.
You'll all have gotten an email from Renee Lambert, Medical Staff Services. She will need everybody to go in and get set up with Imprivata via the fingerprint in order for you to be able to prescribe controlled substances. So there will be basically little fingerprints machine, or a machine there that'll just take the fingerprints. So, but there is a process, there's an app, and you need your driver's license. And I think there's one other thing she needs, you'll need at that time. So if you can come prepared, that'll make that faster. But in order to do the abbreviated way to do the controlled substances, you'll need that set up. Thank you, Tim and Wade. Anybody else have any questions? Okay. Well, if you guys have questions, you don't either ask here on this in the setting, or something you think of after this meeting, please email it to myself or Tim, and we'll get the answers, and we'll get those out to people, because I know people have questions. I'm getting asked them a fair amount, but I just want to make sure that as we're getting those, that we can get those answers to the masses, especially if there's people that have more than one or more than one question out there. So thank you for your time, and we'll get this sent out to you guys later today.
Thank you.
Thanks.